So we're here today to talk now. I hope we're all here to talk about the same thing, which is this idea of sharing information and resources with your community using social media. Yeah? Okay, good. Thank you very much for the opportunity to do this. We will take about 10-15 minutes to take a look at this. Hopefully it'll be a little bit of fun. And any questions that you have during the course of the presentation, please feel free to yell, scream, raise your hand, or whatever is socially acceptable to you. First things first. Social media is like any communications medium. If you do not know your audience, you're wasting your time. So how should we know our audience? My guess is you actually know the audience better than I do because you're working with this population all the time. So I'm going to show you research that I didn't do, which means you can criticize it all you want, and I would love to hear your feedback about it. But research has been conducted by Robert Wood Johnson Foundation and their partners to get a sense of, among those people who are still uninsured, what's going on. And I'm going to take you through that real quickly here. I should mention, for those of you who are nerds and want to know, is this a real study? 1,200 people, 18 to 64, 469 Latinos, folks speaking English and Spanish, all respondents were uninsured at the time of survey. Okay? What did we find out? What we found out is things haven't changed much from the very beginning. And namely, that most uninsured individuals think having insurance is important. So what's the problem? Problem is cost. Cost is the main barrier. There is, and it's not just as simple like, well, I just can't afford that. The folks who are left at this point, who are uninsured, who haven't signed up yet, are actually making pretty serious calculated decisions about this. They're not just even looking at premium. They're looking at premium and they're looking at co-pays. They're looking at a pretty detailed thought process about whether or not to have insurance. So we'll get to what all this means in a second. Without question, the folks who are still uninsured are struggling financially but are optimistic. I thought that was a very interesting finding. But we've got folks who are getting covered by access, and we've got folks who have felt like they can afford marketplace insurance. And then we have a whole bunch of folks in between who think, you know what, this is really a choice between electricity or food, and I'm not going to go for insurance. However, they do feel optimistic about the future and the fact that they will be able to afford insurance soon. The reasons they're putting off insurance: the ability to still get care and pay for it out of pocket. They have a perception that they can do this for less. Rather than get insurance, they can go to a clinic, they can go to a doctor, they can negotiate a payment, and that will cost them less in the long run than having insurance. They see insurance as a commitment, one that they're not willing to make on an annual basis. Almost half have not gotten health insurance, not gone to the health insurance marketplace. So that's good news. They don't even know what they don't know yet. And another 10% are unsure if they might have or might not have. They're not really clear on that. And there are substantial gaps. I love it when the researchers say things like that. What they really mean is these people don't know anything about tax credits. They've never heard anything about tax credits. And they certainly, and this is played out year after year, but now it's more serious than ever, right? They certainly have no idea about the fine. So, this notion of, I always, whenever I talk about the fine, I always think of that old, do you guys have AMCO commercials here back in the day? The transmission people, you can pay me now or you can pay me later. So at this point, it used to be the fine was $95 in the first year. Oh, big deal, right? I mean, it was a big deal, but not a huge deal. Now we're looking at, help me, $695, is that right? $695 or 2% of household income. So it becomes almost that you can pay me now or pay me later. Not that I would ever tell you to say that to somebody, but okay. So let's take a look at these 6 takeaways a different way with circles around them. Okay, rectangles. All right, the green box up at the top, if you can tell that's green, I see as an opportunity, right? Most people think that health insurance is important and having it is important. The green box at the bottom, comprised of points 5 and 6, is also really important, is also a great opportunity. They don't think they've been to the marketplace, they don't know about tax credits, and they don't know about the fine. The research that I'm excerpting this from has also shown very clearly that the fine is a motivating factor for about 1 out of every 4 people. Once they know about the fine, they go, oh, I should just go ahead and get insurance. It's this area in the middle that's a little concerning, and if you can't tell, that's meant to be yellow or orange, I guess. This is the tricky part, and I honestly don't have a whole ton of answers for this one. Because when it becomes a decision about what to put on the table versus having insurance, that's a really tough one. But there may be some ways to work with that, right, in messaging on social media. That's why I'm bringing all this up, of course. All right, I'm going to back up these other ones really quickly, because this is just a little bit deeper look. 73% of people say it's important. These are people who don't have it yet, but who know it's important. That's a huge number. If I was a real-time marketer at an advertising agency, I would be licking my chops, okay? 71% want help, and they want it from an individual. So these are huge opportunities. All right, so what does this have to do with messaging? Remember, we need to know our audience before we know what to say. That's why we're doing this, okay? 71% say they want help. 1 in 4 say that the fine will motivate them, right? All right, so this is where we were last year. We said to ourselves, look, it is a complex thing. Insurance is a complex thing. But when we talk about it, we got to make it as simple as possible. And so last year, this is the way we walked. It's time, right? Open enrollment is now. Because the other thing that's not in this research, or else I just missed it, is almost everybody has no idea when the open enrollment dates are. All right? So this is a really crucial communication message. The time back then was November 15th, February 15th. It's affordable, right? You can get tax credits. It is the law. Yes, you will be fined. And even better, you do not have to do this yourself. We can help. So what does this year look like? Just different dates, That's basically it, right? So when you're thinking about social media messaging, especially if you only have 140 characters on Twitter, there you go, right? It really needs to stay that simple. And I know you've heard a lot today, because Alan was before me, so I know what happened. There were lots of details. And details are important, right? I mean, this is not an easy thing. I wish that President Obama had never said it's as easy as buying a plane ticket online, because it's just not true. This is tough stuff. Getting insurance is not easy, but getting people to make the decision to get insurance is. See the difference? And it's as simple as telling them when the open enrollment dates are, the fact that they can afford it because they're going to get tax credits, the fact that it's the law, so if you don't buy it now, you're going to pay the government later, and finally, that there are people who can guide you through this mess. Whoops. All right, so what are the rules? What are the rules of social media communication? Number 1, always think about your audience. It's not about you, unless, of course, you just had an experience with an audience member that you can write from. All right? Number 2, always be as clear and concise as possible. How many people have Twitter? How many people have Facebook? Right? Because the whole world's on Facebook. That's what I've heard. All right? How closely do you look at the messages on there? Do you study them in detail? Do you break them down paragraph by paragraph? You do not. Okay? You look for a picture. Oh, that's my cousin. And then you read a couple of things. Right? Pictures matter. But keep it simple. Be as clear and concise as possible. One message is best. If you've got a message that complements the other, go ahead and do that. Like, hey, you're going to get a fine, but not if you sign up between the open enrollment dates. That's 2 messages, but they go together. Positivity and helpfulness, right? Nobody really wants to be clubbed over the head, even though I just gave that example of, hey, you're going to get a fine. All right? Be as helpful as you can. Be as positive as you can. This is difficult. It's something that people don't feel good about. They are making a decision between putting food on the table and getting insurance. Be sympathetic or empathetic of that, and do something that's encouraging in your messaging if you can. Be visual. So that was that part about when you're scrolling through, you look for pictures. I'll show you a couple of examples in just a minute, but some of the stuff that was done during open enrollment last year is just, you know what, if you're having an enrollment event, or if you're the person who's going to talk to somebody about insurance, post your own picture. Hey, I'm a real person. I don't bite. I can help you, right? And then say something nice about what they should be doing. Number 5, this one is something that I hope we can do really much better at this year than last year. There are a number of organizations. One of them is obviously the Cover Arizona Coalition. Another big one is the Arizona Alliance for Community Health Centers. Arizona PIRG is here today. These are all folks who are already on social media and already posting messages that have been thought through and are out there. Share them. Just share them. It'll be so much faster for you, and it means so much more spread of that message for everybody else, right? So that's the simplest thing you can do on social media, is look for the folks who are already messaging about this stuff. Could be healthcare.gov, could be Robert Wood Johnson or the Kaiser Health Foundation or Kaiser Health News, doesn't matter. Just, retweet, reshare. And if you want to add a little something of your own, please do. And then the last one is don't stop. And don't stop means just simply this. I don't know if you guys have ever really checked out, how scary it is that a message on Twitter, the number of messages that come through on Twitter in a day. Even if you only follow a few people, it's just a deluge, right? And it's not that much better on Facebook. So if you want to be noticed, you got to keep doing it over and over and over again. And don't think to yourself, oh my God, I've talked about the fine and the dates so many times that I shouldn't do that anymore. Wrong. Keep doing it. If there's one thing you can learn from the advertisers of yesteryear in the 50s and 60s and 70s, same thing over and over again. It's not old until it's not new anymore. All right, just some quick examples like what I was talking about. I went on to the Facebook page of the Cover Arizona Coalition and just pulled some stuff that we could talk about real quickly. So this is my point about being human. Look at this goofball with the sunglasses on, right? If they got frisbees, of course I want to go talk to them. No, seriously. I mean, they're just showing that they're human people, and that's a good thing. Somebody is here who is not a bureaucrat, who wants to help you, who knows how to have fun, and is a real person. Good stuff, right? This one, I kind of got these bunched up, but there's this one in the middle. You see, we did a lot of this where we just took that icon, those 4 icons, and we just kept putting the icons up like boom, 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 hammer it, hammer it, hammer it, okay? And then you see this one from Keogh Health Connection, another great source for stuff that you can share. But just the idea is to just keep the messages moving. Here's another example from Cover Arizona when we were doing a one-day enrollment event. Hey, you know what? There are 3 easy steps to this. Make an appointment, bring your documentation, and then get in-person assistance with your application. Okay, it went a little bit longer past that. But they got to see that, and they got to see the image, and it's like, okay, I think I know what the steps are. This is Arizona PIRG over here on this side. So now you're looking at, well, unfortunately, it doesn't show very well on the screen, but that's a trio of students walking down the sidewalk learning about health insurance, right? So people being able to put themselves in that picture is a good thing. Hey, how about this? How about this for positivity? We are so excited for National Youth Enrollment Day. It may be hard to sleep tonight. Diane may need some help, but all right. This is Twitter, right? Enrollment events happening now. Go to Cover AZ events to find one. Former Phoenix City Councilman Tom Simplot. Well, I never would have said the word opines, by the way. I'm not sure how that got in there. On the need for health care coverage. Last day for open enrollment. Go here and we're taking walk-ins now. Here's the address. I mean, these are all pretty quick and simple messages. And then you will find, if you look in the center here, this one from healthcare.gov. I don't know if you can see that. That's one of those balloons. That's a balloon shaped in the number 2. And they did that every day for the last, I think, 7 days, 14 days, it seemed like. Every day they would post a picture with a new balloon. How many days are left? It's stuff you got to do, and it's not a bad thing. People are going on to social media to find out what's going on with their friends and their family and their life. And when they see that balloon, they go, "Oh, I only have 2 days left." Let's see. Oh yeah, there's 3 days left over in the corner. I just noticed that. Sorry. You see our friends at Enroll America, when President Obama did the really funny video last year, they went ahead and posted that. Billie Jean King talking about signing up for health coverage. Share that. Go for it. But relatively simple, quick messages. I got to give props to Alan and his crew. Unfortunately, you can't see it in this picture, but what you're looking at in the top left corner is, if I get this right, Alan, staff members posted pictures of themselves doing the things that they do in their leisure time to sort of say, hey, here I am. I'm a real person. I go hiking. I have a dog, whatever. And that's great. You're humanizing the people who are going to be helping the audience. That's really terrific. Here's another one where, finding and enrolling in health insurance daunting. Well, here's Cynthia. She's right here. She's ready for you. Click this link and we'll hook you up with Cynthia. That's good stuff. That's smart stuff. It's simple. It's concise, it's short, it's positive, it's helpful. Okay? 2 more rules, and then you can go. 2 more rules. Skip complicated. Just don't do it. Let Alan do that other times, but not in social media. All right? And just be part of the conversation and have as much fun with it as you can. That's what it resonates with people. Everybody wants to have that fun. Last rule, and you didn't see it much because there were mostly links that you couldn't see where they were going. But the connector, the connector, the connector. Now here's what I mean by that. You're all familiar with the Get Covered connector? Okay. So I have been in marketing and advertising for 25 years prior to being in the nonprofit world. And this is what we would call in the marketing world a complex sale. And believe me, I've done some really tough ones like hearing aids, which have a 7-year decision-making cycle. It's true, because people don't want to admit that they have hearing loss, right? And the trick to anything that is a difficult sale is to get people to at least raise their hands and take the first step. In this case, the first step is making an appointment with somebody who can help them. And the best way we have to do that, the most versatile, the place that has the most availability, the most convenience for the people you're trying to help is the Get Covered connector. So, if you're looking for something to tell people to do, it's as much as I'd like you to say, well, I got a friend over here and you should call them, and that feels good, it's not effective. Because what you've done is you've given them the option to do something. They haven't done it yet. But if you have them and they say, yeah, you know, I really should talk this over with somebody, you go, guess what? I can get you an appointment right now. And that is a huge, huge difference in getting people connected to coverage.